Hi everyone, welcome to another episode of a Doctor's Aspects on Healthcare. Today we have a very special guest with us today, Dr. Slim. Thank you so much for being us with here today and taking time out of your very busy day. So how are you doing today?
I'm fine. I'm very fine, and thank you for inviting me. I'm
Thank you
so
so much.
excited to.
We're very
Okay, thank you.
excited. So would you like to tell our viewers a little bit about yourself?
Okay, I am Justin Edwin, famously known as Dr. Slim, simply because I am slim. I am slim, so they famously call me Slim.
Wow, that's great. And where are you
Mm.
located and where do you practice medicine?
Well, I am from East Africa, a country known as Tanzania, and I am located in the Rukwa region. And
Wow.
I practice at the Mercy Medical Health Center.
Okay, and while you were doing medicine, was there a moment when you decided that this is what I want my job to be and I want my career to be? Or was it just when you were a kid that you wanted to grow up and go into medicine?
No, it's quite a long story, but cutting it shortly, uh, I had other ambitions, like becoming a pilot or a teacher or someone else. But in 1998, my sister was involved in an accident and she got burned on her left limb, lower limb, and she was diagnosed to have osteomyelitis. Then, after time, she was taken to the hospital. Many medical personnel tried to diagnose and doing examinations on her, and they decided that one of her limbs should be taken off. They should cut it off. Thank God, the other year in 1999, there was a team of doctors coming from USA. They came at a certain hospital. It was a religious hospital known as I can't remember that. It has
Mhm.
been quite a long time. They came when they did the examinations and they found out that it was the fibula that was affected. So they decided to do an operation and they cut off that, that bone. So from there, I heard the calling that this is simply maybe due those previous doctors, they lack the experience, lack the more knowledge. They were not specialists. So I was admired that one day I should be someone who can get involved direct to people's life and save the life of the people.
That's
Charity begins at home. Yeah.
that's such an inspiring story.
Thanks a
So,
lot.
what's your opinion on the healthcare in Tanzania? Does everyone have access to healthcare there?
No, no. When you are talking about Tanzania, you are talking about one of the poor country in East Africa, in Africa, especially here in Africa. So access to healthcare services is very low, and access to education, access to healthcare, they are very low. It's not adequate. Many people are suffering. I can tell you that there are people that are born at home. They were given birth at home, home deliveries, and we have got a very huge, a large number of women who deliver at home. Their children have not vaccinated, and there is no access to health services, so it's quite very bad.
And how has COVID-19 affected you personally and Tanzania as a whole?
What?
How has COVID-19 affected you personally and in the sense of the healthcare system there?
Okay, in Tanzania, COVID-19 was a very big threat. Simply, as I said before, access to health services is very low, but also knowledge of the people, the citizens. They know very little about their health, but also equipment that those protective equipment like PPEs. We have got the mask, we have got sanitizers, running water, those which were supposed to be used to protect the community against the disease. And knowledge. Knowledge is power, but many people lack information. There are places where there is no even a cellular network. If there is no cellular network, there is no television, no newspapers, so people are lacking information. So COVID-19 was a seriously pandemic that was a big threat to my country and to Africa as well.
Okay. And how do you think we can improve this? Because how can we improve the healthcare system? As a whole, what changes should be made to the healthcare
How
system?
can health policies should be improved? Health policies should be improved, and both government organizations and private organizations should improve their policies and go direct to the people, especially in the peripheral areas. You know, when something like this pandemic happens, all the information that we get from those rural areas, we get from those big cities, but those people living in the peripheral areas, they are forgotten. And there, the burden is very big. The burden is very big. So to overcome this challenge, you need to give information. You need to have well-trained medical personnel that will go to the field and give education and ways on how the citizen can protect themselves from this pandemic.
And how can we personally, like each one of us, how can we help those who have been affected by COVID on a personal level?
The ways to help them is making the right diagnosis as clinicians and as doctors, but knowledge is everything. Knowledge is everything. You know, here the tradition here, when you want to greet someone respectively, you have to shake hands. So you need something. You need more efforts to convince those people that this pandemic can spread through contact. You see, so education should be provided. Education is power. Information is power. Knowledge is power. Knowledge should be provided to them, but also campaigns to the peripheral areas should be reached, but also empowering medical personnel. I can assure you that even in some hospitals, they are lacking equipment. You can see even in a hospital, there is no sanitizers.
Yeah.
Some dispensary health centers, they were lacking even masks to protecting themselves, which is a high risk.
So, do you think that enough information was given to everyone about COVID, or it could have been handled
No.
in a better way?
No, here in Africa it is quite different. Here in Africa it is quite different simply because, as I said before, there are places here in Africa, peripheral areas, even a cellular network, it is difficult. No cellular networks, no televisions, no newspaper. How do you think these media will deliver the information when they lack even networks? Loads, infrastructures are poor at all.
And has the vaccination drive started there?
No vaccination that have been made, and there are no updates about that. No updates about that.
And so do you think that there's been a difference in how COVID-19 has affected people? Like some people in some areas, some rural areas may be affected more as compared to people living in more urban areas who have access to more information.
Yes. The information given are not relevant, and many people are suffering, and the information And you can see maybe today you can report 10 people have been diagnosed to have COVID-19, but there are some information that are hidden. You see, maybe you can be having 100, but only 10 can be announced.
And do you have any ways on how we spread the information better?
Pardon?
Then do you have any ways better ways in which we can give information to people who don't have access to it?
Uh, Here, where I practice, it is in a village, so the information can be given through those local leaders, village leaders. When they conduct the meetings, is where you can educate the mass. Many people can come and at the meeting, and there you can give the information, and obviously a few number of people will attend the meeting, just simply because of the ignorance. Sometimes they just ignore, sometimes they just know, they doesn't know the real impact of this pandemic. So you can find some of the people coming, get the information, and some will just neglect it. But it is our job to make sure that the correct information is reached to the society and the people, and the implementation of what should be done is being done by the government and the non-government organizations.
And is there adequate information about medicine in the area?
No, the information is not adequate. The information is not adequate. Many people are ignorant. We have a few number of medical practitioners. You can find a health center lacking specialists. You can find a health center lacking nurse. You can find health center lacking doctors. You see? So it is inadequate.
And how can we, as normal people, instead of just the government, help to overcome these problems?
It is our job. It is our job to spread the news, but also to raise the voice. But also, I think those non-government organizations should provide equipment like those PPE, protective equipment, as well as raising funds for those organizations that are supporting these campaigns. It is very important for the society as a whole to get directly involved in fighting this pandemic, not only to leave everything to the government.
True.
You see? Yes.
So that's it for the questions we have. Thank you so much for joining us, and I'm sure that everyone who sees this will learn a lot. Thank you so much for
Thank
joining
you
us.
so much. Thank you so much.
Thank you.
I wish you all the best.
Have a good day.
Okay, bye-bye.